the issues that we're really concerned on in East Asia and the Pacific, which is EAP, the violence and abuse against children. And it's not just sex tourism, it's things that are happening within countries. It's easy to blame outsiders, but there's a lot of things happening nationally, and it's a real concern. And the low number of professional trained social workers, and I'm delighted that we'll be hearing about some work in Cambodia about that, of what we can do about the poor quality of professional training and the lack of services if you want to make referrals. So some of our approaches is to move from the symptom, looking at just the symptom of it, to a more system approach. So, 500 million adults in this Asia-Pacific region still lack basic reading and mathematics skills. I mean, we're so proud of how far we're advanced, the economic tigers, the real progress of our region, but we're still leaving so many children behind who, as they mature into adults, are not equipped with the basic literacy and math skills to improve their livelihoods and support their families. While we have higher primary school enrollments, we still have low retention. Children are dropping out before they graduate. Survival rate up to grade 5 between 70 and in some countries almost 100%, while Cambodia and Laos are still lagging. So not necessarily high enrollments, and from that low enrollments, we have many children dropping out. Grade 1 with early childhood experience, and on the left, what's the survival rate of the children who enroll in grade 1? How many make it to grade 5? So you can see countries with really low, under 20% early childhood experience also have very low survival rates. And those countries up here with almost 100% of their children getting early childhood experience also have really high completion rates. So if you can get that early learning experiences, chances are you'll perform much better as you go through primary school. Unicef and health. This is nutrition. And so I'm delighted that we'll be hearing more about health later. But the blue is underweight, the yellow is stunting, and the light blue is wasting. Underweight could be the result of many different causes. But stunting is a long-term effect of low nutrition. And that's really hard. It's hard to have remedial efforts to change it. Stunting is where you start getting the effects on the brain, or the effects on the body that you can't address later. Whereas wasting is the most chronic. That's quite severe levels of malnutrition. There's so much work that needs to be done, and it's through salt ionization, it's through iodine fortification, it's through nutritious foods and feeding practices. Parents don't know that the child's stomach is so small, so they maybe only feed 3 times a day instead of 5 or 6, even though there's food in the kitchen that they could be serving. So it's not just lack of food, it's sometimes a lack of awareness about feeding. Or if a child is living in an unhealthy environment, as Aaron was saying, where they're drinking polluted water and they're constantly getting diarrhea, they will start suffering from stunting because they can never maintain their weight. And then of course they'll have some brain development issues. So our key interventions from UNICEF, well, a key one is immunization support. It's something we've been doing for 50 years, and it looks like we cannot stop anytime soon. Cold chain logistics. Do you know what a cold chain is? Well, we're still waiting for the magic discovery of a vaccine that doesn't have to be refrigerated. Right? As it is, you get a vaccine, it's usually 10 shots in a vial, and it's got to stay cold. I worked in Nepal, and you saw these porters carrying a cooler on their back up to these remote health posts where there's a kerosene or a solar generated refrigerator to keep those vials cold. Because once they become warm, they're useless. In fact, they can be dangerous. So the cold chain is an essential element of keeping the vaccines moving to remote areas. Children who have HIV, it's around 150,000 in this region. So I mean, compared to sub-Saharan Africa, we're far better off. And that main transmission route is mother-to-child transmission, as well as some through unsafe injections or unsafe blood transfusions. Again, and many of these children are of injecting drug users, sex workers, men who buy sex, etc., which makes them that's what's making them vulnerable. It's estimated that 5 million children would also be, with 25 to 29% women, and this is feminization. But the key thing that Unicef is shifting to, in this region anyway, where the epidemic is actually pretty modest, is stigma and discrimination. Rejection, isolation, denied basic access to facilities because of the disease.